Story 1, Two Perspectives. I am a retired emergency room physician. When patients are physicians, I use more medical terminology and assume a certain level of sophistication with respect to physiology and disease. I present my thoughts in ways that invite a higher level of participation in both diagnosis and decision-making. I often ask patients what they think is wrong. If I am dealing with a fellow physician, a physician assistant, a nurse, a paramedic, or another clinician, I always make sure I know what they are most worried about. As someone who was recently a patient with a serious illness, I now make a point of telling my care team that I am a physician. I did not always do this, but my consultations are more streamlined, I feel more involved in decisions, and I receive more information. Story 2. I am not a doctor, but I am married to one who does not use Reddit. Medical doctors tend to be fine. He is in a niche field. They understand the limitations of their own knowledge and that standard protocol may have changed since they learned about the field. He tries to avoid mentioning his career when he is a patient. I hate receiving medical care with him around. Some doctors and nurses use highly technical terms to talk about what is happening with my health or our children's health, without bothering to explain. When that occurs, he waits to see if they are going to translate, turns away from them, tells me everything they should have, and then asks if I have any questions for my doctor. It also happens when he is not around, if they somehow know he is a doctor. Story 3. There is a curve. Caring for someone with no medical background is usually fine, and caring for someone with extensive medical knowledge is also usually fine. The difficulty arises when a person has limited medical knowledge, often someone who has worked in an ancillary field but never as a clinician. That is when the Dunning-Kruger effect appears. The patient or a family member believes they know as much as or more than the medical team when they do not. Those situations are the most difficult. Story 4. I am a nurse who works in surgery. I was going through discharge instructions with the parents of a small child who had just had his tonsils removed. They were very nice, and just before they were about to leave, I found out they were both pediatric critical care physicians. I joked, "Wow, I am preaching to the choir," and they said, "No, we appreciated being treated normally." I have had other situations where I am explaining how to prepare for surgery and I receive a lot of eye rolls. I will joke, "You know something, don't you?" which usually makes them smile. They often admit they have extensive medical experience. I tell them they are always welcome to refuse any interventions they do not want, or to tell me if they do not want me to repeat information they already know. I say this laughing out loud. I try to be as genuine as possible. Story 5. I am an anesthesiologist. Laypeople know almost nothing about my work. Even many medical professionals know very little about it. Story 6. Taking care of doctors has always been a breeze. They understand the limitations of their own knowledge. Taking care of mid-level providers such as nurse practitioners and others is usually equally easy, although it involves greater anxiety and more questions. Taking care of nurses is hit or miss. Some are cooperative and easy to manage. Others are difficult because of social media influence, especially TikTok, and an I did my own research attitude. Taking care of certified nursing assistants and veterinary technicians is often more challenging. The Dunning-Kruger effect can be in play. They consider themselves part of the medical field but often lack the knowledge or the ability to distinguish good information from bad. There are exceptions, but when someone leads with that job title, I expect to encounter misinformation that can impede the patient's outcome. Almost anyone can fall prey to the "but my sister's friend's roommate's cousin says" argument. Story 7. My husband is a hematologist, and our family doctor often asks him for informal consultations about other patients during his appointments. Story 8. I am a cardiology nurse practitioner. I would rather have a doctor than an engineer as a patient. I said it. Story 9. Honestly, it depends on which side of the room I am on. When I am the patient, I want to be treated like any other patient. Many doctors ask for my opinion about what else they should do. The gesture is nice and shows respect, but my expertise is in one specialty, and I appreciate having someone else lead on my health. I can raise a concern if I strongly disagree with the plan, but that has not happened so far. When I am the doctor, I like to know if the patient has healthcare or medical training. This allows me to use more technical terms, which adds some efficiency to the visit. Otherwise, I treat them like any other patient. Story 10. Usually it's smoother if you're humble about what you know. Acting like a know-it-all can make things tense quickly. Story 11. As a pharmacist, I usually try not to let doctors know what I do for a living because half the time they will ask what I want them to do. I want them to treat me. I do not want to prescribe for myself. Story 12. I am a certified registered nurse anesthetist. Nursing assistants are the absolute worst to take care of. Physicians are usually the best. I apologize. This is the truth. Story 13. Most doctors are professional and knowledgeable. When I go to the doctor, I defer to them because I am the patient and they are the specialist. I ask more specific questions than a layperson, but that is all. The most difficult patients are those with some medical knowledge who assume they know as much as or more than physicians, or people who have done too much online searching or consumed social media and become angry when a medical professional's assessment and treatment contradicts their expectations. Often my explanations fall on deaf ears or are interpreted as confrontational. Some patients expect medicine to be purely a service industry and demand whatever they want, rather than treating the visit as a consultation with an extensively trained physician who assesses the diagnosis, recommends the best treatment, and explains the rationale. I have learned to stop engaging with these patients and advise them to seek someone else who better aligns with their expectations. Arguing is not worth the frustration and often leads to exaggerated or false negative reviews online. This problem has increased dramatically since the pandemic. Story 14. From what I have seen, doctors usually do not get angry if you are right. They care about how you arrived at your conclusion. If you say, "I searched online and this matches my symptoms," a good doctor will check it, either confirm it or explain why it is something else. The attitude is more "okay, fair point," than "how dare you." Story 15. I was a night shift pediatric intensive care unit nurse, now retired. Many years ago, I was admitting a toddler and had no idea about the parents' level of knowledge. They were scared and overwhelmed. I treated them as I would any parent, explaining what was happening and why and outlining the anticipated course of treatment, since it was respiratory syncytial virus season. At the end of my shift, the mother came out to thank me for letting her be a mother and not a medical expert. They were a very nice family. Story 16. I am a nurse practitioner and I sometimes see medical doctors as patients. They generally give excellent histories and have good insight into their conditions. I treat them no differently than I would anyone else. I just know that I need to be at my best when I explain things, since they have much more context for understanding and asking questions. I would much prefer seeing a medical doctor than a retired registered nurse, a massage therapist, or someone who took a few college biology classes 20 years ago and insists on challenging everything I say. I do not mean asking informed questions. Some people are simply rude for no reason. Story 17. Generally, it is easier when my patient is a doctor. The interaction becomes more of a conversation. They can weigh in on recommendations and we exchange ideas. I find them respectful and willing to accept my recommendations as long as I can support them. Occasionally, a patient comes in giving orders. At times, I have to draw a line. Any orders, referrals, or prescriptions I provide reflect my professional opinion. If a patient is unsatisfied, they can see a different doctor. Story 18. More efficient. When everyone speaks the same language, there are fewer communication errors. Story 19. It is fun when it is collaborative, but it is annoying when it turns into a debate. Story 20. I am not a doctor, but I am a medical professional. I work in the laboratory. One of my doctors was relieved that I had medical knowledge because it made it easier to explain my condition to me. She was able to use larger terminology and did not have to explain some concepts. Medical professionals do not know everything, especially if you only have a 2-year degree like me, so I still need things explained. I have a strong foundation of general knowledge that made it easier to discuss medical issues. In my view, it makes my life easier, but I do not know how my primary care physician feels. My obstetrician-gynecologist was making small talk during a pap smear once and did not know what my job was when I told her. I said I work in a medical laboratory, and she asked, "Like LabCorp?" I said yes, but at a hospital. She seemed surprised and then started talking about doing phlebotomy. I do not do phlebotomy, but at that point she was examining me, so I was too uncomfortable to correct her. Story 21. It is interesting. Doctors, as patients, often understand the risks better, but they also underestimate their own symptoms because they are used to seeing worse. Story 22. If they know what is best, they will remain silent and keep that secret at all costs. Story 23. They both nod and say I concur until someone intervenes. Story 24. I am a paramedic, not a doctor, but I have treated doctors. The most memorable was a woman who became intoxicated and injured her head at a football game. She refused care beyond having the wound bandaged. When we arrived at the emergency department, I told the charge nurse it was a head injury, and the patient said it was more of a laceration. The charge nurse asked, "Is it on your head?" I laughed. The patient then gave the full report when we reached the room. I said, "Yes, that pretty much covers it." Healthcare workers are notoriously poor patients. I know many who conceal that fact to avoid drama, but I find it helpful to mention because it speeds up explanations. Once, a technician secretly gave me a suture removal kit and told me to hide it from the doctor, then suggested I should apply for a job there when I was in the emergency department after a dog bite. There are benefits. At least I did not need a follow-up appointment just to remove a few stitches. Story 25. I usually do not tell my own doctors that I am a doctor unless it is relevant. Years ago, when I saw a fertility specialist, I let it slip and they said that since I was a doctor I would know about the who's-it and the what's-it. I wish they had explained it as if I were 5 years old because it was not my field and I remembered very little from medical school. Story 26. I am not a doctor. I worked in a laboratory long ago and had a basic understanding of what the laboratory results meant and whether they were good or bad. I am not an expert. My son was admitted to the hospital for a week because he was turning yellow, his liver and spleen were enlarged, and his urine was the color of tea. They could not figure out what was going on. It was not hepatitis or anything like that. The hospitalist he was assigned to understood after our first interaction that I had some idea of what the laboratory results meant. He made me feel like part of his team and included me every time he reviewed the results. I felt like I had no control over anything, and that doctor gave me a bit of control. On the last day in the hospital, before scheduling a liver biopsy, they had an infectious disease doctor see my son as a last-ditch effort. He was in the room for about 10 minutes. He was an absolutely wonderful doctor, by the way, a truly kind soul. He asked my son if his throat hurt. My son said yes. The doctor said, "I think you have mononucleosis. Sometimes it just presents like this. Not even terribly unusual." He ordered tests to confirm. The tests were positive. My son had mononucleosis and went home that day, hospital day 5, with strict instructions not to lift anything heavy or engage in contact sports. He was fine in a couple of weeks. I will never forget how the doctor who reviewed the laboratory results made me feel. Competent in a situation in which I was terrified for my child. Thank you to every single wonderful doctor out there. Do not stop doing what you do. Story 27. My dad is a gastroenterologist. When his hip replacement was not healing properly, he had his partner at his practice perform his colonoscopy. My dad then watched the footage and diagnosed his own colon cancer. Story 28. 99% of the time it is perfectly fine and quite pleasant. Very rarely, I will care for a patient of another physician in a different specialty who thinks they know my specialty and does not understand the standard of care. Nothing in medicine is conceptually difficult, but some things take more than a couple of Google searches to learn, even if you are a doctor of medicine. Story 29. Mostly relaxed. I just need to explain things without assuming either nothing or everything. Story 30. I'm a nurse, and I have a lot of empathy for worried parents who are doctors or nurses and come to the emergency room with their child just in case. I have seen the freak cases too. Visits that were expected to be quick and routine but that ended with a serious diagnosis. When someone pretends to be clinical but is not, approaches me in bad faith while I am trying to help, and uses a small amount of information they do not understand to bully or attack me and my team, that is not acceptable. Story 31. It is easier because they answer my questions directly and do not go on a tangent about something that happened to them 10 years ago when I ask whether they have had a symptom recently. Story 32. Having other doctors as patients is incredible. It is so streamlined. It is like the movie Forbidden Kingdom, where Jackie Chan and Jet Li fight each other. You could tell they were two experts communicating, and it felt incredibly natural. Story 33. I am a medical doctor in a surgical subspecialty. I prefer to know when a patient is a physician because I can use more precise technical language. As a patient, I prefer the care team to know I am a physician so they can use technical language without translating it into everyday English. Story 34. People often give themselves away when they use unusual terms or pronounce difficult words far too effortlessly. Every so often you encounter extreme entitlement. For example, a woman snobbishly criticized her nurse's care and tried to dictate what tests I should order because she said she worked in healthcare. When I asked what she did, she said she worked at the front desk of a pediatric office. I am an emergency physician, but I try not to let people know I am a doctor when I receive care. People tend to order too many tests, or conversely avoid uncomfortable tests or questions for other medical professionals. Very important person syndrome often leads to worse medical care. For example, my primary care physician was initially hesitant to tell me he should perform a testicular examination to check for cancer, and I had to reassure him that I wanted the same care he would give any non-physician. A commonly studied scenario is a female doctor who presents with pelvic pain. Clinicians may avoid asking about sexual partner history and miss pelvic inflammatory disease, which can cause permanent infertility. Similarly, clinicians may hesitate to perform a pelvic examination on a colleague, risking a missed ovarian torsion with fatal consequences. Story 35. As a pharmacist, when I seek care, I try to hide that I am in the medical field because I know there is a lot I do not know, and I want explanations in layman's terms. Story 36. I was the computer technician in a neuroscience lab. My mother had a stroke. The principal investigator let me borrow a 1,500-page neuroscience textbook for the trip home. 2 days later, I heard that the doctor had given orders for her to be transferred to a long-term unskilled care facility. While I was still processing this and feeling furious, the doctor walked in. He repeated what we had heard from the nurses about the transfer. I said, "She still has an anomic aphasia." The internal medicine doctor said, "Wait, you didn't just hear that term on the street." I replied, "I work in a brain research lab. The new orders were for speech therapy, occupational therapy, and physical therapy. May you be as fortunate when your time comes." Story 37. I find that having some medical knowledge forces the provider to actually work to explain why my questions or concerns are legitimate or require follow-up. How many AskReddit threads describe people having to strongly advocate for their concerns when a simple online search could have provided answers or symptom relief? Most of the help I have received for medical problems has not come from doctors. Many do not have time to help you. The good ones find a way, but that is rare. The system is designed that way. Providers who do not practice a certain way are squeezed out. Get a second opinion. It is not always just in your head, as someone suggested to me. Remember that you are the one who must live with your symptoms or disease, so education is key. Except, of course, if you did not go to medical school, then you just do not understand. Story 38. Highly educated people typically recognize one another, and that streamlines communication. It is like interviewing employees. You can tell the difference between someone who is faking it and someone who has been in the trenches. Many details snap together and create that recognition. The problem is when people get medical information from Google or from artificial intelligence and confuse that with real understanding. If they come in thinking they already know the answer and are only looking for a certain outcome, it can be exhausting. Story 39. I'm a primary care physician. I tell my fellow doctor patients to tell me what they want and cut the bullshit. I have not had a problem. It's that easy as long as I'm okay with it, and I would do the same for a non-doctor patient. There have been a few times I have declined requests even though they were doctors. Story 40. The only difference is that I use medical terminology freely. As a patient, I don't disclose that I'm a surgeon because it can alter clinicians' decision-making. They can get nervous. I may ask a question if I think care is going astray. If my care requires hospitalization, I cannot hide my identity because I will be recognized, but I prefer to be treated simply as a patient when possible. Story 41. I am a veterinary pathologist. My general practitioner and gynecologist have been very respectful of my knowledge of physiology, and I appreciate that. I also make it clear that I do not treat humans or animals, do not prescribe medications, and do not know human clinical best practices. It works well. I follow their instructions, and they take the time to explain their medical reasoning. Meanwhile, most practicing veterinarians have horror stories about medical doctors and nurses doing something that is standard for humans but can seriously harm a pet. I assume that is not typical, but those stories are the ones people share. Story 42. I am not a doctor, but a nurse practitioner. I start by speaking to everyone in layperson's terms, regardless of background. Usually, when people come to see me, they are not at their best, so I treat everyone the same. If they want a more detailed explanation, I provide one. I have found that most medical and non-medical people appreciate the way I communicate. Story 43. Honestly, it goes one of two ways. It comes down to their knowledge of that specific area combined with unwarranted confidence. Doctors can be morons, too. Story 44. An urgent care doctor was very rude to my well-informed partner last week, even though he knew what to ask for. The doctor said, "Okay, let us stop with the technical jargon for a start." My partner went through triage, had his tests done and his breathing checked. He was prescribed exactly what he asked for and what he had described using technical terms. Story 45. I hope I do not come across as a Dunning-Kruger patient. I have had a fairly extensive medical history, and as a test engineer I research my lab results and practitioners' interpretations, translate medical jargon, read medical papers, and ask in-depth questions. If I question the doctor's plan of care, it is only to learn the why and how. In my last few hospital visits, during the initial rounds with the attending physician, I summarize what is happening and my surgical and medical history. Sometimes at that point, or if I ask a follow-up question, they ask if I work in the medical field. When I tell them I am an engineer, they respond, "Ah, that makes sense. I figured you had a science background." Normally I take that as a compliment, but some responses in this thread make me wonder if it was a slight jab. Story 46. It is very hit or miss. Some are normal. Others are completely unpredictable. There is very little in between. Story 47. A doctor once asked me whether I was a nurse. No, I am autistic and have special interests. Story 48. Short answer. They are either the best patients or the worst patients. There is no middle ground. The best patients provide a concise history, understand the plan immediately, and you do not have to explain things using the phrase "explain it like I am 5. They are very efficient. The worst patients are convinced they have a rare zebra disease, question every decision, and sometimes downplay serious symptoms because they think they know better. They are a total time sink. Story 49. It is really difficult depending on the situation. Treating another doctor in general is challenging. You either over-explain or under-explain, usually the latter. It is best if you do not know they are a doctor. People assume you know everything about their field and do not give basic instructions because they expect you to know. You also know enough to understand the acronyms medical students are whispering about your newborn, or to recognize what decelerations mean on the heart rate strip and that your obstetrician is busy with a cesarean section that is taking priority. They will often let you direct your own care even if you are too affected by medications to make complex medical decisions. They also often do not explain the significance of laboratory results, again because they expect you to know normal values for every test. Story 50. Patient is a physician, doctor of medicine or doctor of osteopathic medicine. Good encounter. They know their limits and are respectful. Patient is a pharmacist. I fucking love them. Patient is a nurse, nurse practitioner, physician assistant, certified nursing assistant, phlebotomist, or janitor at a clinic. Worst possible encounters. Karens from hell. Dunning-Kruger effect. These are generalizations. Story 51. I know I sigh a little when I hear that my sister's boyfriend's aunt is a physician and she says so. Story 52. I need to say that emergency room doctors and general practitioners should not prejudge a patient's knowledge of a relatively rare, long-term condition. You may not be trained in that illness while the patient has been suffering for years. This is not to discount your intelligence or training, but you are not a specialist, and we have specialists for a reason. If another emergency room doctor tries to give me acetaminophen for a hemiplegic migraine, I am not seeking drugs. A cigarette would do me more good than acetaminophen because migraines are not a typical headache. They involve vasodilation, not vasoconstriction. Story 53. I have a complicated medical history. Cystic fibrosis, recurrent acute pancreatitis related to cystic fibrosis, and now chronic pancreatitis. I also have chronic complex migraines and other conditions. My preferred doctors understand that I have been managing this for 26 years. I know my body, I work with my specialists, and I expect to be treated as a respected member of the care team. My least preferred doctors are those who disregard the information established over the past 20 years, decide they know better, and unnecessarily complicate my life. For example, when I tell a provider that morphine makes my pain worse but they insist on trying it anyway, it can cause involuntary screaming. I do not appreciate that. Pancreatitis is painful enough. This has happened. Morphine is now listed as an allergy to avoid that. Some of us may not have formal medical training, but we understand our conditions and our bodies. We know a lot and should be trusted members of the care team. Story 54. Not a doctor, but an experienced registered nurse. You can generally tell immediately if someone is actually a medical professional by the way they interact and the questions they ask. However, some medical professionals are rude or unpleasant, so they can be difficult regardless. Story 55. Encounters can be awkward at times but are usually fine. They can be problematic for the same reasons any intersection is. I am not sure how much detail to provide when a patient has medical knowledge but not experience in my field. Story 56. It's kind of nerve-wracking, to be honest. Overall, it's okay. They usually formulate the plan and I go along with it. Story 57. Actual physicians are fine. It is everyone else. Less training leads to a greater Dunning-Kruger effect. Story 58. My husband is a urologist, and I have many gastrointestinal issues. At those meetings, he has no input because that topic was covered 6 years ago. He knows his lane and stays in it. Story 59. I am not a healthcare provider, but I have a medical physiology degree and used to teach clinical reasoning. When I have been a patient, I have occasionally encountered doctors who were annoyed when I discussed my symptoms and possible diagnoses. However, most of the time they do not mind because my visits become quick and easy. I know what I am talking about and they do not have to simplify explanations. Residents are sometimes surprised when I see them because I obviously know a lot, but they get over it quickly. Story 60. I am a retired cardiac specialist technologist and nurse and spent a lot of time training new physicians on medical technology. After 12 years in retirement, I feel left behind in the field. At this point, I do not tell my healthcare providers about my past affiliations because they tend to assume I understand the most current clinical recommendations and approaches, which I do not, especially if they are outside my field of training. I would like them to discover my previous medical experience when I ask appropriate questions. Story 61. I am a patient. I thought this was funny. I was neat and well-dressed when I met my new psychiatrist. I was seeking ketamine therapy for chronic pain caused by cancer treatment. I had done some reading and learned about at-home telehealth ketamine therapy. I told him to look into it because it might affect his practice. He looked at me curiously and asked if I was a doctor. Story 62. I am a retired registered nurse. I can cut through the nonsense and call doctors out on the financial incentives they bring into decisions. I advocate only for myself, not for them. Story 63. I am in medical school, and I do not like to mention it because I feel like you get the student experience instead of the patient experience. Story 64. If the patient is a doctor or a physician assistant, care is usually straightforward. Such patients tend to get straight to the point, do not need extensive explanations, can readily participate in shared decision-making, and have realistic expectations. When a patient's family member is a provider, there can be a power struggle with the family member attempting to direct care. The same can occur in doctor-to-doctor interactions, though not always. To be honest, the most difficult situations are often when a family member is a non-physician healthcare worker. I will not describe details here to avoid offending anyone. Story 65. I am a veterinarian and a board-certified small animal internist. Some medical doctors and doctors of osteopathy respect my knowledge. Others use a very basic approach. I do not self-diagnose. I rely on them to make the diagnosis. Humans and pets share many disease processes, so I dislike being patronized and excluded from the diagnostic reasoning. Many, however, value my questions and input and ask about similar conditions in their patients. Story 66. Wouldn't hiding the fact that you are a doctor be more useful? Story 67. It's a sidestep for sure, but I trained as a veterinary technician in the United States in the mid-2000s and moved to Australia in 2017. I did not practice in Australia. I did not even practice in the United States. It was way too stressful. I ended up doing pet sitting, working in pet shops, overnight kennel, daycare, and grooming facilities, and even a brief research laboratory position that turned into in vitro fertilization laboratory work until I moved countries. I brought a cat from the United States with me, and he was diagnosed in Australia with gastrointestinal lymphoma. In the United States, when I said I had veterinary technician experience, they appreciated that they did not have to use layman's terms, but they still did everything because they did not want to risk someone getting hurt by their own pet and possibly bringing litigation against them. In Australia, the clinic responded differently. They asked if I was looking for work and immediately asked me to hold my fractious cat for an enema. He bit me badly. I do not blame him at all. I told her many times I would prefer he bite me rather than her staff, and that she should handle him more gently when I was there. They also sent me home with fluids for him whenever I asked, because they trusted my previous experience even though it was years old. I loved that clinic. Too bad we moved away. They helped us adopt our next cat after Stratus passed away, and they covered most veterinary expenses for Tonks whenever she needed anything done, since she had been their clinic cat. Story 68. Many years ago, I had a conversation with a doctor using medical terminology. I do not remember why I knew it, but the doctor smiled and we cut a half-hour discussion about my condition down to about 6 minutes. I managed to keep up with him and the diagnosis was quick and certain after just a few tests. Maybe he appreciated not having to listen to long-winded descriptions of symptoms, or maybe he was simply glad a patient turned out to be right for once. I certainly appreciated that he did not respond with condescension. I doubt I could ever do that again. Story 69. Oh, thank God. It means I do not have to spend 10 minutes going through everything in layman's terms, and we can just talk shop, come up with a plan, and be on our way. Story 70. I am not a doctor, but one of my aunts was a nurse in the 1950s and 1960s. Once when she was very ill, she tried to see one of the doctors at the hospital where she worked. It was usually hopeless because the doctors would dismiss any complaints as typical nurse complaints. That probably meant menstrual issues because the nursing staff were all female back then and the doctors were almost all male. As a result, throughout her life she waited until she was in a very bad state before seeking help. She had heart disease and diabetes, so that was dangerous. Eventually she waited until the last minute before seeing a doctor and had to be admitted immediately for surgery. I think it was a gallbladder removal. She woke afterward to find some of the doctors there. They asked, "Why didn't you tell us how bad you were feeling?" They never believed the nurses were genuinely ill. A funny addendum. She had a crush on one of the doctors. This was before she went traveling and met the man she would marry. He asked her, "Is there anything I can do for you?" She later told me, "This was the moment. I could have asked him anything, to wipe my fevered brow, anything. But all she could say was, 'Hand me the bin. I'm going to throw up.'" Story 71. My doctors are the best. Patients are polite, on time, and respectful. Most professionals are like this. Nurses are mixed. The worst are radiology technicians. For some reason, they are demanding and act like they know it all. Story 72. Communication styles vary, but since I am an older woman, I use that to my advantage. I explain that I do not have the professional background to make the decision and ask how they would advise their grandmother. They tell me outright. I double-check with friends who are medical professionals. Story 73. I am a veterinarian, so my perspective is a bit different but still relevant. It is a real hit or miss when I am treating a pet that belongs to a medical professional. Sometimes it is great. If the client is a nurse or doctor, we can streamline the conversation because I do not have to explain as much, and it is kind of fun to swap stories since many diseases, physiology, and pharmacology overlap, although there are also many differences. For example, dosing the same medication in different species can be very different. The milligrams per kilogram doses of certain common medications are much higher in dogs and cats because they metabolize drugs differently than humans do. Then there is the other side of the coin. Some clients have decided we are not real doctors and constantly question every diagnostic and treatment decision because that is not how things are done in human medicine. Clients in the first group may ask about these things out of curiosity or to better understand their pet's care, but clients in the second group are simply disrespectful. Story 74. I'm a retired physician assistant, and the only issue I ever had was when one of my former students saw me instead of my regular provider. He was so miserable it was obvious. I told him I didn't mind, but he admitted he never wanted to see me again. I've had numerous instances where I agreed to have students perform my admission history and physical, since the staff knew I taught. I always received great care, and it's all about paying it forward. Story 75. I have a doctor of philosophy in medicine with a focus on neuroscience. When asked, I mention it for two reasons. First, I appreciate being given the detailed view rather than the simplified version. Second, I find that medical staff relax and treat me as family. You can see a change in posture and in their thinking when this happens. I also say that while I have some medical knowledge, I am not skilled below the neck, so they should not assume I know their area. This avoids the Dunning-Kruger effect. Story 76. I wish all my patients were fellow doctors. It would make things much easier and more efficient. Story 77. I am not a medical doctor, but I notice that when doctors know I have a Doctor of Philosophy degree, I receive more respect. I am not sure how I feel about that. Story 78. Just a dude with too much anatomy. If I am in the emergency room, there is a reason. I am usually trying to keep as much blood inside as I can. Losing a couple of pints does not bother me. Losing a couple of quarts does. Story 79. I am an internal medicine physician and hospitalist. I prefer when the patient has medical knowledge because it makes explaining the treatment plan much easier. It is usually obvious when someone has medical training. It is difficult to hide. Some nurses and physicians may pretend not to know to see how they are treated, but people familiar with healthcare behave very differently during examinations and history taking than other patients. I did not enjoy it as much during training. There is a lot of theater in medicine, and it felt strange to explain something to someone who was clearly more knowledgeable. It almost felt like disappointing another attending physician or professor. Story 80. It's fine. They just have access to real physicians, so they don't have to deal with the bullshit we do. Story 81. I am not a doctor, but I am a patient advocate specializing in pregnancy complications and termination for medical reasons, meaning needing an abortion in a medical emergency. My clients who are physicians or spouses of physicians appreciate receiving full transparency when their pregnancy develops complications. Doctors do not necessarily withhold information from non-medical patients. Rather, a shared professional understanding produces greater bluntness and transparency. This is especially important in states where doctors feel muzzled about discussing abortion. They can speak with fellow physicians in ways they avoid with laypeople, which increases access for patients who are physicians. I have seen cases where a woman believes her life would have been lost if she had not been bumped to the front of the line before the full extent of the emergency was apparent. In one case, a surgeon was called from a friend's personal number with the message that his wife was dying. Because time was of the essence, that made a difference. This is described in the book I'm Sorry for My Loss. The authors are friends of mine. The podcast The Retrievals Season 2 explores this dynamic. A labor and delivery nurse's anesthesia failed during her cesarean section, and because the patient was a provider known and trusted by the team, The experience spurred a movement to overhaul pain management during cesarean sections. It is worth a listen. Sometimes, when women in the stirrups report pain, it is not always taken seriously. When a physician reports pain to another physician, it is more likely to be believed. Story 82. I imagine it is either much easier or much more annoying with no in-between. Story 83. I have no medical training, but I am highly educated and scientifically literate. I understand that correlation does not equal causation. I know the basics of statistics, and I recognize the limits of evidence and so on. I also seek to learn as much as I can about the conditions that afflict me. My doctor says he likes dealing with me. I think that is because I know enough for clear communication, and also enough to know I am not a fucking doctor. Story 84. I am not a doctor, but I was a nurse, and I definitely know when I am being medically gaslit or when someone is attempting malpractice against me. Story 85. Every one of my mother's doctors and nurses has asked whether I am a doctor or a nurse. They did not ask because I know everything, but because I explain her issues well and, as one person noted, I effortlessly pronounce medical terms. I have no medical background whatsoever. I am simply neurotic and have been watching Grey's Anatomy since its inception. Story 86. Not a doctor, but an experienced registered nurse. You can usually tell immediately whether someone is a medical professional. The way they interact and the questions they ask make this evident. However, some medical professionals are difficult to work with. Story 87. As an emergency medical technician, I went to see a retired colleague who had been on the job 40 years. I said, "Shit, here is my first in bag. I am sure you know how to use all that equipment." Story 88. How about someone who has graduated from Dr. Generative Pre-Trained Transformer College? Story 89. I am a chat generative pre-trained transformer doctor. I call out my physicians all the time. Story 90. A nurse friend said most patients participate in their care more than the general public does, while some simply ask to be treated as a patient. Story 91. I suspect doctors find the internet quite annoying, while patients are concerned because they often self-diagnose and then turn to doctors for solutions. Story 92. I am not a doctor, but an experienced registered nurse. You can tell immediately whether someone is a medical professional. The way they interact and the questions they ask and so on make this clear. However, some medical professionals are assholes, so they are difficult regardless. Story 93. As a physician, I generally find that other physicians are fine. I treat them like any other patient and explain things because my field is fairly niche and has many high-tech advances. Nurses and other clinicians are hit or miss. They typically ask insightful questions but often ask many. Sometimes their questions are off the mark. As a patient or family member, I try to summarize things for a smoother consultation but defer to the specialist. Story 94. I am not a physician, but I hold a Doctor of Philosophy in biology with a background in human immunology, disease, and epidemiology. When I expect to see a doctor multiple times, I let them know my background. In most cases, they discuss things with me more openly and straightforwardly. I have been with my general practitioner for more than 10 years, and I have noticed how he has become much more receptive to my input and concerns. I have even been able to show him studies supporting a course of treatment that was helpful. Story 95. I will offer a veterinary perspective. I am a veterinary technician with 8 years of experience. I work in a general practice, so I do not see many other technicians because they almost always stay with their old practice when they retire. We have several people who say they used to be veterinary technicians but were never licensed and only worked as assistants for a year or two. They usually provide poor care because they do not want to spend money on their pet, and anyone with a large animal background tends to treat cats like cattle, which is very frustrating. Actively practicing human nurses are the worst clients. They think they know everything and try to be as cheap as possible. Physicians tend to be better but still usually complain about pricing. Retired nurses are usually great. We have had several instances of nurse practitioners prescribing medications for their animals and using them incorrectly because human medicine dosing does not directly translate to animals. This also happens when we send prescriptions to the pharmacy. The pharmacist sometimes says a dose is too low or too high even after we explain it is for a dog and dosing is different. Story 96. A doctor from the East Coast, unlike doctors in Oklahoma, diagnosed acquaintances with the following conditions. First, a pea-sized bone in the hip joint that caused pain for 2.5 years. Second, pain for 2 years after kidney stones that were actually hernias, and a tumor in the renal area that 2 doctors missed for 5 years. I suggest you see a doctor from the East Coast who attended the University of North Carolina at Chapel Hill School of Medicine. Story 97. I'm a scientist with a medically related Doctor of Philosophy degree. My doctors usually include me in their treatment decisions, and for some ailments they let me take the lead with their guidance. I have been on lithium and other mood stabilizers for 20 years. I make all decisions about changes, and they simply order my prescriptions. For treatments that are new to me, I let them take the lead. Story 98. Semi-related, but when else can I vent this story? Quality gender-affirming healthcare is few and far between in the United States and here in Australia. In the United States, there might be 6 gender-affirming care doctors in an entire state. Some of those are overly cautious, relying on outdated information, or actively sabotaging the process. We have to be cooperative about our knowledge, goals, and timing. At the same time, vetting a doctor as a patient is really tough. None will admit shortcomings, and they do not like being called out on outdated knowledge. Getting in with a new gender-affirming care provider often takes months. My first gender-affirming care provider, I trusted in their judgments, but when I started asking for more information on my laboratory tests, they got defensive. I have encountered a lot of transgender people who can tell you their estrogen timelines from memory. I had to switch providers because the current administration did not want me to have health care. My second gender-affirming care provider and I had an hour-long conversation about transitioning goals, estrogen level ranges, optimal targets, and so on. It was great. I had to move because of physical safety threats. Also, apparently laboratories can decide not to test estrogen if anyone along the way feels like it. They still charged me and my insurance company. In Australia, any general practitioner can provide gender care. Great, right? Not exactly. I went to one to transfer my United States prescriptions to Australian prescriptions because my gender-affirming care provider was leaving their clinic due to the administration. The first general practitioner I saw gave all kinds of outdated information and anti-transgender talking points. Luckily, they could not prescribe my dosing method, so they could not affect my transition at that point, only waste my time. For the blood test, they tested at the wrong time. It should be the day before injection to get the values at their lowest, put the wrong gender on the form, and had no idea what estrogen level ranges should be for transgender women. They called me to go over the laboratory results and panicked because my levels were 10 times the maximum according to the lab report for a male. They quoted levels with no units. I am used to mass per volume units, while here they use moles per volume. They emailed me the laboratory results. After converting units, I was within an acceptable range and slightly above the optimal range according to my second gender-affirming care provider. I have another appointment with the second and a third general practitioner in a few months. At this point, I just need a doctor with current knowledge to double-check my levels. So that is my experience going from an uninformed patient to a more informed one, because a chunk of the world does not want us to exist, much less thrive. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.